Welcome back to another episode of Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey on a very rare Wednesday evening.
Crazy.
And even with a more rare guest this evening.
We've talked about it for quite a while.
The man, the myth, the legend, Bryan, our bartender behind the bar,
Bryan,
usually on
thank
Tender.
you to the show.
How you doing, guys? Pleasure to be here.
He's always
by accident.
Yeah,
By
by
accident.
completely by accident. Dr. Frey and I just had a bunch of life going on in the last 2 weeks, and
College tours with my daughter last week. Pretty excited. I got to meet someone that we had roundabout talked about along the way, and hopefully maybe having that guy on in the near future. But yeah, so we didn't do anything last week.
right.
This week, my daughter was getting.
You told me about this guy.
Yeah, it's very cool. Yeah, my daughter's getting inducted to like so many other kids. It was a National Honor Society. My son's soccer team. They were in the South Jersey semifinals. They won that game last night, so now they're going to the finals. So yeah, like we haven't been able to do our normal Tuesday show. I don't remember the last time we recorded on a night other than Tuesday.
Definitely way before my time. I think
Right.
Jason pulled a couple off on a Wednesday.
I feel like when you guys first started, you were Wednesdays for a little bit, but it was too far for you.
Right.
Because you guys were starting way later.
Right.
Yeah.
And then so it's been a long time. It's been pretty consistent. Tuesday night record, Friday morning, post, or Thursday night post.
This is a rare event, and then we were just getting ready for the show. Then Bryan walked in.
Bryan walks in the front door.
And he's not working on a Wednesday night, so.
It's fortuitous.
Fortuitous. Yeah. And Bryan, man, you know hockey, but we've got a little problem with hockey. They classify the injuries too broadly. We never know what really was going on. So
Yeah, that's
tough
where
to
my
talk.
medical expertise ends, upper and lower body injuries.
That's the
I have
bottom
no
line.
business being on this show other than I work here.
Yeah. Take care of us and serve up some pretty delicious beers.
Well,
Yep.
But speaking
love
of
doing
which,
it.
Yeah. So we got one of the new ones on tap. You said just this past weekend, right?
So that's Stay in the Sleigh, Frank.
Yeah.
That's our Christmas spin on our Stay in the Car, Frank. It's kind of reminiscent for the beer nerds Sierra Nevada celebration. It's kind of in the same ilk. Has like those West Coast orange, Valencia orange, like that kind of flavor. It's a lot of fun. It sells super fast every year. We were out of it before Thanksgiving last year.
Holy crud,
To
man.
the point where I was sneaking in here on Thanksgiving morning, making myself a crowler at 7 a.m. Because we didn't have any more here. So, yeah, that's a great seller.
Right.
And it's good. I mean, I went off the rails tonight and got something that's not a sour, which is probably the first time in a long time I've done that too.
Yeah, super hoppy, kind of IPA, and like a little bit out of my standard comfort zone. It's usually porter, something dark, Belgium, or sour, right?
Yeah.
So going off of that, so if you think that's hoppy, this would would ruin you pretty much. So this is the Next Level 5, which is our West Coast IPA, which Frank, he doesn't do a lot of West Coast, predominantly because they probably wouldn't sell great around here.
Right.
Not a very popular style, but people who love them are married to them.
That's true.
And it's exciting. He does these once a year. This is the 5th version of it. They've progressively have gotten more bitter every year.
Yeah.
This one is topped off with spruce tips. So it has that real piney, earthy West Coast flavor to it. When you think traditional IPA, this is a home run.
Is that right?
Yeah.
Yeah.
That's definitely not my cup of tea, I would say. But
Yeah. Exactly.
I venture to guess we are opposite on the beer flavors.
just a bit.
By
but
knowing what you drink every week. Yeah.
Being the guy that serves us.
Yeah, being the
each
guy that
week.
serves
Yeah,
me
right,
every
right,
week,
right.
absolutely.
And it is interesting. Like it's the timing is good. I'm glad that you walked in. We were able to get you on and talk a little bit about it and talk a little bit about beers because we haven't seen Frank in like
In a while.
6 months.
Yeah. So
He's back there brewing.
He's a total agent of chaos. He'll text the group at 6 a.m. on a Sunday, and he's like, "I just finished brewing." Meanwhile, he's been here for like 3.5 hours with Devin, our other brewer, and he's Willy Wonka. You know what I mean? He makes some really cool flavors, but we haven't seen him a ton either. He's tied up in the same spot you are though.
Right.
His daughter's in first year of college. Matt's getting close to being graduating.
Right.
And the Luke is doing the whole college hunt now.
Right.
Yeah.
Actually, one of our former beer tenders just walked in. He's from Texas, so I haven't seen him in a while. But
Look at that. Just a good Wednesday night.
yeah, I didn't know he was coming in either. So
Look
this
at
is,
that.
Yeah.
It just all works
good
out.
night. You thought you were getting out of here quickly.
I was coming to cut a couple labels and get the hell out of here, but
Here we are.
Here I am.
You're on a
That's-
podcast now.
yeah.
Look at you go.
And I'm chatty, so I might be here all night. So.
That's okay.
Quite all right, man. We can do that.
Yeah, so it's just unfortunate we didn't have any good hockey stuff to talk about, and like we've always said, we've just not avoided it. It's just hard to get information. Not like the NFL and NBA, or like they just tweet about everything.
It tends to have to be a bigger story, right?
Yeah.
Like something big is going on. The player's disgruntled about something or other, and and then the information gets out. Like the more the details about the injury, then we got a good hockey topic.
Yeah.
But that doesn't happen that frequently.
Yeah,
like
I think
typically.
we've covered, like you said, the big stories. Like I forget the name.
Jamie
there.
Landeskog, I remember you guys did.
Yep. Yeah,
But that one was like after the fact, right? Like
Yeah.
he was already ruled out of the season.
Yes.
Like
and it was way after, and it kind of comboed with because someone else had the same surgery, and he was a couple months behind Lonzo Ball, who we
Lonzo
talked
Ball,
about
that's
like
right.
two
Yeah, yeah.
episodes ago,
Yeah.
ironically. And we jinxed him because then he also got hurt right after the show came out about something else, so he missed more time.
Oh boy.
So we cursed him. So our apologies, Lonzo Ball, on that one. We talked about that. We did a disc replacement surgery, I think.
Yeah,
and
we
then,
did.
Chris Letang and his stroke history. We talked about that
That's
one.
always a big one.
that's
Yeah.
heavy.
You know,
That's
Yeah,
heavy.
yeah.
Yeah, that's we've kind of covered all the crazy bases. And again, but those stories are just so big where it's like hockey. Just most of the time you see something, just lower body injury.
Ironically, we're in this stage, so I'm going to ask you a question.
Oh, yes.
So, from your standpoint, as being an athletic
Athletic
trainer,
Yeah.
Yep.
the whole like upper body, lower body injury reporting, is that harmful or beneficial to the player? Because like in the playoffs, we know these guys just play through,
Yeah.
Yeah.
heaven and hell. It's,
Yeah.
But I've always wondered that, like, is that a dangerous thing to do? I know it's like in
In
their
what sense?
CBA,
Yeah.
like,
Yeah.
is it there to protect the player, or is it?
I think it is. I think it's there to protect the player.
I guess
Yeah.
I guess you could say it is, right? Like, because in general, the idea is you're protecting their health information. So
Right.
it's just being very vague with it,
Right.
so it's not all out and about. But then you look at it from a competitive standpoint of like you're playing a physical game against somebody, and if you know he has something wrong
X,
with
Y,
the
and
lower
Z,
half
right,
or the
right.
upper half,
I got a 50% chance.
there's a 50-50 shot. Or like if I have him up against the boards, I might hit him a little extra harder to
Yeah.
the top half. Like I don't know, like I'm sure it could, but I guess not having those details protects it because they don't target the left hand versus the right hand,
Right.
or whatever the case is. And hockey is hard because you're so covered up with so much padding that you can cover a lot of tape jobs and a lot of stuff. And I mean, when I covered hockey in grad school, I had a rare foot injury, and I was like, I don't have to tape this stuff. Hockey skate is just so rigid. Like,
Yeah,
you
yeah.
just put that thing
Like
in
a
there. It's
brace.
like wearing a boot.
Well, that's
Yeah.
why I tell the guys, like, don't take it off in the intermission. If you
Right.
hurt your foot, just let it go until the end of the
Yeah,
game.
exactly. So yeah, I think it's a little bit of both, but I think in general it does protect the player. But knowing any injury information,
Yeah.
I think
In what way would you suspect or be concerned it might be harmful? Just because once someone knows there's an injury, they're going to come after him.
I
kind of a
mean,
thing?
50% of your body when you're moving 35 miles an hour is like a pretty easy target. I feel like
Well
it's,
said.
that's fair.
Right.
Like a up top check versus hip check,
Yeah.
depending on the injury, probably makes sense.
but I was always just curious about that. I never knew. I guess it is to protect the player as much
Yeah.
as possible.
And I think the biggest thing is HIPAA, right? Like so there's this fine line you got to walk where it is that person's medical information, but then the NHL as an organization is also feels as though they have an obligation to tell the public why or what's going on, and
Yeah.
the different teams have an obligation to each other as to kind of keep them informed about information. So I think it's sort of like this, you're kind of stuck between a rock and a hard place. So to just find that little wormhole kind of in the middle. And there didn't used to be the tents on the sidelines of the NFL
Right.
games. Now there's a blue tent, right?
Yeah.
Right.
So you can go and check something out without technically doing it in front of everybody. So you're trying to protect some privacy and that sort of a thing. So I think you hit the nail on the head, right? It protects them from a privacy standpoint, and probably protects them somewhat from targeting, so to speak.
Yeah.
But then you flip the idea too, where like we talk about the NBA and NFL. Like the NFL is just as violent, and it's just another violent physical contact sport where like we know everything.
Right.
Like not everything, but so much. But I also think like external stuff comes into factor here, like fantasy football, gambling, and all
Right.
this other extra things. Because NFL at the end of the day is an entertainment business, which the fact that it's a business is something we're going to touch on later. But they have to drive the business, right? And whatever's going to make all this stuff work better. Yes, more details and stuff. And I think just the revenue numbers is higher, and then like it almost kind of works out, right? It's like NFL is the top. They tell us all this stuff, and I get these ridiculous amount of information for these injuries.
Right.
Then the NBA and MLB are kind of up there too, and then the NHL is kind of lower revenues on them, but again, more privacy and whatnot.
It's still game. I mean, I guess baseball is big enough, and there are enough games that it's tough to catch up with. Like, I don't know, NHL finally and appropriately, I think, continue to rise in popularity.
100%.
As MLB. So,
You have to be a psycho to gamble on hockey. Just
That's right.
How comfortable are you sticking around and rapping a little bit about?
That's fine. I'll dive in. I'll see how far I can go.
Even before we go down that road, I feel like it was yesterday but it wasn't. It was 2 days ago, but I was all wrapped up with a bunch of stuff yesterday. Did you guys watch Miami?
Not Buffalo. Rams. Miami Rams.
Miami the Rams. Did you watch that game
I
at
didn't
all?
watch
No?
any of that game. No.
Oh my God. So
did you see? I think I know where you're going. Yeah.
For the love of God, man.
Was
As
it
we're
Sunday?
talking about
Was it
injuries.
game-
Monday
Monday
night. Yeah.
Yeah, he throws an interception. So I know what you're talking about. He throws an interception and goes to make a tackle and just, I mean, one of the worst form tackles. Head first dives right into the guy's knee. Gets head like he gets
This
kneed
whole
in the
big
head.
thing. After, there he is
After
posturing.
all this stuff.
Yeah.
And then which is crazy, which is really hard to it's hard to feel bad for the guy when he just laughs it off like his brain is just some replaceable thing.
Right.
And it's tough to watch in that regard. Like he just kind of that wasn't good tackling. He just
He's playing like every quarterback that you scream at for 10 years. Like Michael Vick, used to drive me nuts how he used to. It's like, you don't have to do that.
Right.
You don't have to do that.
No.
Carson Wentz.
Yeah.
I mean, these guys, God bless them, but it's like, you're going to cut your career real short.
And Carson Wentz
did. Yeah.
Pushing over to make that extra couple yards.
It's a double-edged sword, right? That competitiveness is what the reason that they're there in the first place, right?
100%.
And they got them there, but at the same time, they can't let it go.
You'll get paid once on that attitude, though.
Yeah.
Right.
And I think with that too, it's just there's so much money invested in him and Tua, and then you see that from a film standpoint. It's like, all right, so then this offseason, everyone was talking about, you got to slide more, all this. Then you don't slide, you get knocked out, and you're on IR, you're out for 4 to 6 weeks, however long it was.
Yeah.
You come back, and the second game you're back, you dive at someone's legs with your head
Terrible
down
decision.
of all things. Now,
Fortunately, he was okay.
Fortunately, he was okay. His brain made it okay, but then tackling with your head down and just asking for a neck injury, and that's even more catastrophic than this long history of concussion, which is just tough to watch because I get it. Football is very dangerous, and I'm on the sidelines of football every weekend of my fall, for the rest of my life, pretty much. This is how it's going to be.
Right.
And I get it, but sometimes you can take some risks down a little bit, and it's you're just asking for it.
Yeah.
At that rate, and it's just unfortunate to see a career that could be short-lived if this continues to happen.
Hey, as a quarterback, he doesn't know how to tackle.
Yeah.
That's
why he went into that position.
Yeah.
Right. Exactly. All right, so we got ourselves a little smorgasbord to talk about.
Oh yes, we went deep into the reports here of NBA and NFL because again they give us all this information. But I think the biggest name talking about quarterbacks who make a lot of money and are a big investment for a franchise is Dak Prescott.
Your favorite, Bryan.
Yeah, Dak Prescott. That guy's stealing Jerry's money. Actually, I do like that.
You kind of like it, right? It's like, man. So he got hurt on the third when they were playing the Falcons. I believe he kind of made a scramble, kind of rush for a few yards or something along those lines, and then afterwards, the next throw he tried to put some pepper on the ball, and he looks like when he went and extended his leg, he just was in pain, kind of hobbling around a little bit, came out.
Right.
And then it just kind of got reported they had a hamstring injury. And we've talked about hamstrings a little bit here and there on this show.
I feel like over and over because it's so common.
They're so common and so many big names get them.
And
it's
they're naggy, right? The rest of your life, you're going to deal with this.
The vast majority, yeah. I think it's sixfold, right? If you tweak your hamstring, tear, partial tear, whatever, sixfold risk of retweaking or re-injuring it.
And you see it all, and I see it all the time, right? You get these kids back from, you get a patient back from a hamstring strain, they're fine for a week, and the next week they're doing something, there it goes again, and then you're just in this vicious cycle.
Yeah.
And that's why, research says that they can pass functional testing, they can do all this stuff, but there's actually still actual damage. If you MRI'd it, there should still be damage showed. And I tell all my patients this all the time. Look, this is what happened. This is why I'm being conservative.
Yeah.
But it's I can run full speed. I'm but to last in a whole game or whatever the contest is, it's not going to work.
Different story. Right?
Big different story. But the interesting thing with Dak is that at first it was a hamstring, a couple weeks, and then all of a sudden it's like, oh, he might be going on IR. Oh, he might be getting season-ending surgery. He's seeing some specialists up in New York. This whole ordeal, and Jerry Jones was on the radio. He's like, he wants to go out there. He wants to play. We might not treat this with surgery. We'll see what happens. Then he goes and visit a specialist up in New York on, I think, this past week. And then just yesterday or Monday or Tuesday night, it came out that he's going to be having surgery.
Yeah.
Rehab for about 3 months. And then in the reports and other articles I was reading, the option to rest and rehab this would take about 6 weeks, give or take, versus surgery and rehab is 3 months. But the thing is that the articles are saying it's a partial hamstring tendon avulsion.
So it's a partial.
Yeah.
Very interesting. Oh, man. That's very interesting.
Does that make it worse?
No, typically not.
Okay.
So that's what I'm saying. It's very interesting.
Right.
Okay.
Whereas,
and I'll talk about it just a little bit in just a second.
And I think that's what you're going with, where it's like if it's a full tear, it's pretty like when you have a proximal hamstring tear, which
it comes right off of the bone.
It comes right off the bone, right under like your sits bone or like right under your butt, if you will.
Ischial tuberosity.
Ischial tuberosity, right? It'll come right off the bone, and that's like you got to get that fixed right away. Usually it's pretty catastrophic. It's a lot of pain.
So on the northern part of your hamstrings, right, like up near your butt, there are three tendons, right? Your semitendinosus, semimembranosus, and your biceps femoris. And so you have 3 tendons that come off of kind of your sit bone, the ischial tuberosity. And if you have a 3 tendon tear, all 3 come off and retracted, especially as an athlete, that's typically surgery. Like there's not too much of a question about it. It's straightforward. If you have a 2 tendon tear, it's a little grayer. Some people argue 2 centimeters. Some people argue 3 centimeters of retraction. Then you fix that. And if you're not a high-level athlete, or if you're a young athlete, then lots of times you even let that go.
Time.
Time. Give it time, let it heal. And if it's a 1 tendon tear or like a partial tear, almost never fix it. Is really what it comes down to. And unless that person remains symptomatic, like 6 months down the line, then fine, you go in, you clean it up, but it doesn't really retract. It doesn't go very far. Like the urgency is not there. What you worry about with like a big 3 tendon tear or a fairly retracted 2 tendon tear is that after a little while, I think everything starts to tighten up in there, and it's hard to get it back to where it needs to go. So then outcomes, if once you do repair it, aren't quite as good usually.
Right.
So to hear that it is a partial tear, now the devil's going to be in the details. How much is torn is what it comes down to. Are all 3 tendons attached and one of them just partially peeled away? If so, Dak, don't do it. Is what I would argue, at least at this particular point. Or is partial tear mean 2 of the tendons are torn and 1 isn't?
Right.
And then it's a little more controversial and probably an appropriate thing, especially if they're retracted, more than 2 centimeters. Yeah, I know.
I failed most high school science.
So
thanks for teaching me things.
The take home is you're never going to have to go worry about Dak again.
I followed it. That was actually probably the best way it's ever been described.
Well, and I think
that's what we try to do.
And I think that go back to what I mentioned earlier of like that the NFL is a business, right?
Right.
He just signed a 4-year, $240 million contract with $230 million of that contract guaranteed.
Right.
So if you look at a grand scheme of things, if you treat it, conservatively, you wait the 6 weeks, you try to rehab, and you have the chance of running into those issues you just mentioned.
Right.
Having it tighten up, making it harder to go back and fix.
Especially if it's a 2 tendon tear with some retraction.
Versus you shut them down, you rehab for 3 months, you just kind of scrap the season and get whatever else you can get out of it. I mean, they're not doing that great anyway, which is great for all non-Cowboy fans.
But does that answer the question? Yeah. Just their success this year. It's like, okay, well, just go get this done. Like,
right. I think
it is a consideration, even though it's not supposed to be, I think.
Now, if you flip the script a little bit and they're the 9-0 Kansas City Chiefs and Patrick Mahomes has this, is he waiting the 6 weeks to come back? Like someone else who's worth a lot of money.
Oh God, yeah, that's the $1 million question.
And is the cornerstone of everything on that team.
Right.
Yeah.
Like you can't afford to lose that.
Correct.
I mean, I don't think the Cowboys actually could afford it to lose Dak.
Right.
But they weren't in a situation where they were going to do anything.
Yeah.
Right. And the truth is, though, he is a good quarterback, and the reason you fix them is one, from a pain standpoint, it helps, but 2. From a performance standpoint, is the honest answer. So if it is that partial tear, 1 tendon is sort of hanging on there, the other 2 tendons have torn and pulled down. The truth is, for the next 5 years, whatever, however many years he has left in his career, he's probably a better quarterback if you fix it now.
Right.
And the fact that, it's kind of a down year, they're not doing great at this particular point anyway, it makes that decision a little bit easier. I just hope that it is truly a 2 tendon tear, not a 1 tendon tear or a partial, like a small little partial tear. Because honestly, then I think maybe you're being over aggressive. And the truth is there's more than one way to fix these. The standard way, and when I fix these, the way that I do it is a open incision. It's maybe 3-4 centimeters, but there are people who are doing it arthroscopically, which to me is very surprising, and a lot of credit to the people that do it. But there are people out there that do it arthroscopically. I don't know if there's less morbidity when you do it arthroscopically. I hope that there is.
Right.
It's a very strange one for me to think that you can to fix it arthroscopically, but people do.
Yeah, and I think it's interesting, which a couple things reminded me of this whole topic of. I think it was last year or so. I was watching a webinar, and the New York Jets physicians at the time. I don't know if they still are. I even honestly forget their names. I'd rather not even say it.
Fair enough.
Right. They were talking about hamstring injuries and the latest trends and all this stuff, and they were talking about how they MRI almost all the hamstrings they get, and it's just like, as an athletic trainer, it's like I see hamstrings all the time, and I never ever get a MRI on them. It's just kind of not kind of in the algorithm, if you will.
Only if it, like, you can tell clearly it pulled off of the bone.
Right.
You can see the whole
and
thing.
There's a lot of deformity, and you can tell, like, clinically on your your evaluation that something's really wrong. We've got to make sure what's going on here. But they were mentioning of, like, it's not to say that getting an MRI for hamstring is the best gold standard in medical care, but it's also just the best for the business decision of, like, we can see what's really going to happen. We'll know how long this is going to last. We can know how aggressive we can treat it, or if there's a lot of damage, we take some more time, and we don't waste our money by sending this person back in the field and they get their nagging injury. They get hurt again.
Right.
And I just think it's interesting, too, is how these professional sports teams and how they report all these injuries has a trickle-down effect into the everyday lives of sports medicine professionals in high schools and colleges, because now all the student athletes that you have think they're the next best thing.
The Adrian Peterson effect.
Exactly, that too. Is that they need an MRI now when they hear, can I get an MRI?
He got one.
Yeah,
like,
but
that's
he
what they're
got
doing
one.
in the NFL.
Yeah, but Dak Prescott got an MRI and he had to get surgery. Do I need surgery? Like, I can just see that trickling down into our laps very soon.
Yeah.
Just because of this. And again, same thing with Adrian Peterson. He comes back in 6 to 9 months.
Do you remember this?
Yes.
Yeah.
Yes.
Yeah.
I got a word for it, but I'm not allowed to say it.
Superhuman. That's the word. That's the word.
But, it's just crazy how that kind of works. But again, it's a business decision that they're doing all these extra things to make sure they're not, gambling with their money. Like, this guy's worth $250 million. Yeah, they're going to take every precaution to preserve that.
It's not purely a healthcare decision.
Right.
It is. We've actually just talked about this before. Like, on the highest level, it's essentially workers' comp on the highest level, right?
I was going to say,
that's what it comes
catching
down
a comp case.
Yeah,
right,
exactly. It really is.
On the highest level, it sort of alters the way just ever so slightly.
And these guys aren't calling pond hockey. They're not.
Right. Very rarely.
Yeah, not too.
No free ads. Sorry.
No. Speaking of ads, to give a quick shout out to our sponsors. We are sponsored by Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip to yard work back and laptop wrist. They have a doc for that. So find the right specialist for you at virtual.org/ortho. Thanks for that. Perfect segue, Brian. Look at that. You walk up to the bar, he gives you the beer he wants, he just throws you an ad, remind you, like, hey, you didn't read your ad piece here.
What was the topic? Do you remember when we came in and we were searching for topics and Brian's like,
oh, man, it was
Gabriel Landeskog.
That's what it was. It was Gabriel Landeskog.
Yeah, because you guys were not going to do the podcast that night, and you texted me and you go, you know anything? And I was like, look into this.
Yeah, it was awesome. It was a great time. Like, not something you get to talk about very frequently.
No, and again, that's why Brian's the man. He's always given us a perfect assist with all the stuff that we need. So I think that covers most of the Dak chaos, if you will.
We'll see how that one shakes out.
See how that shakes out.
I'll tell you, the toughest part of that surgery, for patients, for people who undergo that surgery, is not the surgery; it's the recovery. And so there's you have to protect that repair, and there's essentially 2 ways to protect the repair, and both are terrible. You got to wear this brace that goes around your waist, and then it has this little extension that goes down your leg, and so you can't flex your hip up. And sometimes people will have it even go down to the knee to try to keep everything protected. That's what I go with because I think that's the lesser of the two evils. I don't go with the knee extension, but I go with the brace and down the thigh, and so you can't flex your hip more than I usually set it at about 30 degrees. Then the alternative is there's a belt that people wear, and it has a little like chain or a little cord that goes to your heel, and it hooks onto your heel. So you sit there with your like this, your knees bent 90 degrees, belted or like chained to your to this belt around your waist.
Sounds miserable.
Yeah.
It does not sound comfortable.
Horrible. Yeah, and so it's a rough one recovery wise. And I try to when people do present with this particular injury, I try to lay a little crepe like it's a rough recovery, and like without fail, every single person's like, I didn't realize it was going to be this bad. Like it's just a hard thing to be compliant with. Because
you don't want to overstretch it too early, because then it's going to ruin all the surgery.
That's exactly right. You're at risk of that.
Yeah. And then so with that being said, we probably won't see any TV time of Dak on the sidelines. He'll probably be up in a booth.
I mean, not at first, but you can't crutch around and with that thing on. It's just like, how do you sleep? You can't lay flat. You can't put your leg flat. Like it's a challenge. It is. Yeah.
No, thank you.
That's going to be miserable.
Right.
Totally miserable.
So as Eagles fans, you guys are thrilled.
It was great
I
last
don't
week.
wish pain on nobody, okay?
That's a good point.
That's fair.
It's good man.
But
It's
you
good
just don't
man.
wish any
That's why
success
Ryan-
on
that's
anyone on
why
the
Ryan's
Cowboys.
great.
You know?
I don't know. That's not my style.
For sure.
That's fair.
All right. What's our next one here?
So the next one to talk about the Eagles, injury that occurred in an Eagles game back on the 3rd same day that Dak Prescott got hurt. Trevor Lawrence injured his AC joint sprain had an AC joint sprain on his non-throwing shoulder. Mm-hmm. There's been some reports that he might be out all year and need surgery, similar to Anthony Richardson of last year. However, he had the AC joint surgery on his throwing shoulder, whereas Trevor Lawrence is his non-throwing shoulder, so it changes it up a little bit.
For sure.
However, he's still having a lot of issues. He managed to finish the game against Eagles, which is just, crazy to think that adrenaline's one heck of a thing.
He played really well, too, in the second half.
Is that right?
Played really well in the second half of that game.
I don't know what they gave him at halftime, but it worked pretty well for that.
I missed that game. I was busy doing my
Mm-hmm. But it's just interesting that this one's like non-throwing shoulder, so you hear a shoulder injury for a quarterback, you're always worried about the throwing shoulder. It's not it. So everyone's like, I would just take them. Why even worry about it? Just an AC joint sprain should be fine. But we've dove into this before, and there's so many classifications of it. That means it's probably on the middle tier to end of what could be like worst case scenario that they're talking possible surgery.
So that's very interesting. This ain't possible surgery. Mm-hmm. All right. So the rundown, and I hate, I'll lose half of our listeners here, but type 1, type 2, no surgery. Type 4, 5, 6, surgery. Type 3, gray area. So quite simply put, it's probably a type 3 separation. So that's up to about 100% displacement there. Lots of times the way we treat them, and really, to be honest with you, the standard form has been treat it non-operatively. Most of them are going to do well. Right. And if they continue to be symptomatic, then do the surgery later. Mm-hmm. There's been progress in the way that we manage these and handle these. And Artex is a really, really good company that I've mentioned a number of times along the way. They're a really innovative company in terms of the instrumentation, different things that we use. And so my gut, I don't know. We don't have access to his medical charts. I have no idea what they're actually doing. I don't even know technically what grade it is, but I'm just kind of guessing here. So it's very quick and simple surgery where you kind of drill a little hole right through the clavicle, and you just do it under fluoroscopy, so live X-ray, right down to another little bone right beneath that called the coracoid, just a little finger projection that sticks out. You basically slide a little button that goes underneath the coracoid and one on the clavicle, and you cinch it together, and it holds it in place. And it's like a 10-minute procedure. It has the potential of just making this heal a little more predictably. Mm-hmm. And again, I have no idea if that's what they're planning on doing, but if I'm reading the tea leaves here, my gut is that he has a type 3 rather than waiting to see if it's going to be a problem down the road. Mm-hmm. It's going to take 10 minutes. Let's just do that, and it'll probably make his life a lot better. Maybe reduce the chances of it being a problem later.
And another quarterback who has a lot of money on his contract, $275 million 5-year contract.
Yeah.
You got to protect that investment as much as you can.
And they're what, 2 and what are they? They're not good this year.
I can't believe they're not good.
They have like this weird stat where they've lost most of their games by 5 points.
Right. Yeah. It's one of those. One of those teams.
They're just.
You got to learn to win.
Yeah.
Yeah, they're just right on the cusp.
They're a very good team.
They have a lot of talent.
Yeah.
It's there.
But it's just not putting it together. But again, when you lose football games by just a couple points, it's just unfortunate.
I find it even more surprising being in the Philly area and seeing Doug Peterson as a coach. I feel like he's a guy that knows how to win. He had a lot of success here. and now he's there. You wouldn't expect him to be the coach that loses by 6 games by 5 points.
He
you
wins
know?
bigger games with backup quarterbacks. Maybe
right.
they'll start
Yeah.
doing well. I don't know.
That's his MO.
Yeah.
Just knock out his primary guy and then
Yeah,
look
right.
out.
So
He's going to be the new Keith Jones, right? Like he was barely here,
Right.
mhm.
but he's just revered for the rest of his life.
Oh,
like
Of course he is. How
Oh,
could he
Keith
not
Jones
be?
is the president of the Flyers. He played like 96 games for the Flyers,
Yeah.
but because he was funny, like
Yep. You win.
There you
It's
go.
how you win the fan
Revere
base.
it.
You know, you find a way. So that kind of wraps up what we had set up for the NFL injuries that kind of came through. And then, when we talked about setting up the show, I sent you a couple links of like a bunch of NBA stuff that was going on because
Right.
the NBA is in full swing now.
Right.
And
Speaking of
big names coming.
injuries or what, like and controversial, Embiid, what in the
Oh,
heck,
man.
Holy cow!
Embiid's a
Did you pay attention to the NBA at all?
I just know he's an enigma.
Yeah.
yeah. It's tough to watch. Like, as they're prepping for this game, they're 2-8.
Yeah.
Paul George and Joel Embiid are right now on the screen saying they're not playing tonight for knee injury management.
Yeah. That's
And
exactly what I'm talking
it's
about.
just like
load
it's
management.
Load management, and they're coming out early saying you'll never play back-to-back games.
Yeah.
Early on in the season, it's like we've talked about Joel, almost every joint in Joel Embiid's body on this show.
Yeah.
I feel like he's 50% of your
Sure.
Oh yeah,
Right,
easily.
right.
I
Yeah.
mean, we did like 3 shows in a month of just Joel Embiid of different injuries.
He's back again.
He's back. Oh, he's injured again. Oh, he broke his face. He did this. Now he has Bell's palsy. Now he has no cartilage in his knee. He's got this. He's got that.
So you need to send him a thank you card.
I know.
Yeah.
We just send him an
Let's
invite
get
and just sit him down.
Get him on the show.
That'd be one heck of a show. I don't think our microphone stands tall
No.
enough for him.
But yeah, we talked about it last year. Getting off script here a little bit. We talked about it last year.
Mhm.
I know we had Dr. O'Donnell on, and we were talking
Yeah.
about, and like, I was worried, man. Sometimes it starts
Yeah.
becoming lateral meniscus more than once, and like, you may have.
And it's
So,
the same thing.
I
and
hope it's not gonna be a big deal, but I'm a little worried this is a big deal.
And then that kind of then it's very nerve wracking to see kind of a similar timeline or situation as Kawhi Leonard with the Clippers, and he's out indefinitely. And we've talked about his knee plenty of times too, where
I know.
he's had all these surgeries, all this stuff, this knee inflammation that hasn't gone away.
Right.
He almost played in the Olympics this year, but then didn't. He didn't
Right.
even make the trip out there because his knee was too bad.
Yeah.
And then there's even more stuff with that case of Kawhi Leonard's injury and all that
Yeah.
stuff with some lawsuits that are coming down the line
Oh, is that right?
with the
with
the staff members who
Here
were
we go.
recently fired,
Yep.
and they're claiming they were wrongfully fired because they were trying to
Oh, right.
Yeah.
We talked about that's actually like
Yeah,
a
that's
really
like
big deal. Yeah.
real big deal of like this. I don't know. It says trainer on the report.
Yeah.
I don't know if that's an athletic trainer or a sports performance. So it kind of meshed the two together in like the
Right.
same. It could be an athletic trainer who has a CSCS, whatever. But they were just saying that they were trying to speak against how they were treating Kawhi Leonard, and that he was fired because of it, and now
Right.
he's suing the Clippers for it. So more to come with that because we don't know too much other than what I just said based
Right.
off the reports that I read.
Why is Paul George sitting again? Like I thought he was actually just cleared. Like, all right, your knee is good again.
Right.
And
you
now
just-
he's sitting.
So is he pushing through that bone bruise from that knee hyperextension, like trying
Yeah.
to do a little too much?
Maybe
and
it's swollen. Maybe
it's swollen,
he's sore.
and
yeah.
then now you get worried about. Okay, so you're telling me his knee's swollen after playing a game.
Yeah.
So what's the integrity of that cartilage looking like?
Then you start worrying.
And
yeah,
then you
yeah.
start worrying about
after
this
an
whole-
82 game schedule.
Yeah.
Like,
Right,
so he's
right.
going to play.
And you're not playing back to back,
Yeah.
so that gives them like 50 games potential that they could play, and then
Now, and
playoffs
there-
would be impossible.
impossible. Then you have to
Yeah.
alternate who plays Paul George and PG, like
Yeah.
or Paul
So-
George and Joel Embiid.
at 2-8, I don't think that's the right conversation to be having. Right.
Right.
Like when we get to playoffs, what
Yeah.
are we going to do then? Like
We gotta get there.
2-8.
It's
Right.
an
Like,
excellent
like
point. It's
right.
an
We just assume based off history of what the Sixers have been doing, they'll get you to the playoffs, get you excited, and Joel Embiid gets hurt, and then we just
Yeah.
lose.
No, and I get that perspective, right? Like
Right.
keep him healthy. But maybe not when you're like there. You can get deep in a hole and it's over.
Yeah,
hopefully that's not the case, but
Right.
we'll see.
We'll see what happens.
Real quick, getting back to what you were talking about, things trickling down to like the lower levels.
Mm-hmm.
Yeah.
Has load management entered the college ranks?
Uh,
I mean,
yeah, no, it
great
has.
question.
No, it has. The term is definitely. I wouldn't say it's more welcomed, but it's more commonplace. Like you see it more often.
these guys aren't getting paid.
Right.
yeah.
These guys aren't getting paid.
Yeah.
But then you have these injuries or things where it's like pretty minor, but the kid or whoever has a knee injury is like, oh, I want an MRI,
Yeah.
and they're uncomfortable with it. They don't know. But your exam is like, well, no, I don't think you need an MRI. It just seems like XYZ, just, but we'll get an MRI. And then next thing you know, there's a little cartilage issue or whatever.
Right.
And it's like, okay, well, you have a little cartilage, so maybe with some swelling, maybe we do have to manage this a little bit and give you a day off of practice or whatever the case is. So it does happen. I mean, I've been doing this for 10 years now, and definitely in the last probably, I don't know, Kawhi Leonard probably started this a couple of years ago. So within the second half, the last 3 to 5 years, it's been more of a thing of like, no, we're just managing him so he doesn't like the overuse stuff.
Right.
I've gone away from the term overuse and I kind of flipped it to under recovery. And I think it sells better, at least from a standpoint of just like, well, no, they're just not recovered. Like their body can't perform without recovery. And recovery is just a big blanket term that's, blazing through the world of sports.
That's
right
true.
now.
Right.
And I think all these recovery tools, modalities, all this and all that, all these companies making the
Gatorade making a fortune.
Oh my God, all this stuff. Gatorade with the sweat thing that you put on you so you know all the exact sodium or electrolyte content that you need to refuel in.
I didn't even know about that.
I think it was the Tampa Bay Bucks were the pioneer of it. They put these little patches on their arm. Same spot every day. You get a patch. It gets scanned. It gets whatever. And it just tells you your levels of all the electrolytes that you lost in your sweat and workout. So their drink mix that they're getting in the bottle is custom made for you.
Seriously.
Yeah.
Oh boy.
So I think it's kind of funny the timing of it because we mentioned COVID or talk when we were talking pre-show. Of just, I think COVID helped that because everyone had individual bottles then. Now it's like, well, what's the point of giving everyone an individual bottle with just the same water in it?
Yeah.
Why not
customize it,
and make it so it's optimizing that person's performance?
And part of me is like, this is fantastic. It's amazing. We're able to do this. We got the data, use the data. And part of me is like, this is just silly.
It's a level of nerdom
I
don't think I've ever crossed into.
Right. Exactly.
And then now now next preseason, everyone's kids are going to be asking, "Hey, can I get a sweat patch? I want to see what I'm missing or what I'm losing out when I practice." Like,
so my 45-minute practice,
we don't have that technology.
I got to coach 5th grade basketball in like 2 weeks. I have to get, am I encountering?
You better
this
get
yet?
some sweat tests. You better get them.
Some sweat tests. You're going to have load management questions.
When Frank's in the back there, you can have him mix up some player-specific Gatorade.
He has made a Gatorade sour before.
He did make a Gatorade sour. Yeah,
he certainly did.
You gotta love it.
So to go back into some of the injuries we had on this list here, we're going all over the place. An interesting one was Ja Morant, who we've talked about last year for his shoulder surgery and injury that ended his season.
Yeah.
Went up for an alley-oop, fell down awkwardly, kind of like on a straight leg. His trunk went forward, his leg went back, and he kind of like gimped off a little bit. And this was back on the 6th of November versus the Lakers. He went up for the alley-oop, he got hit in midair, fell awkwardly, and then he just kind of limped off, and then he left the stadium. Or left the game, and then it was reported that he had a posterior hip subluxation with grade 1 pelvic muscle strains associated with it.
Lovely.
And that's not a good sign.
No.
Especially in a basketball
glad it wasn't
play.
dislocated.
Right.
Leave it at that, right?
You talk about dislocations, and then you're talking Bo Jackson type things where it's not so great.
Problems. Yeah.
My wife's like, "Where the hell are you?" Sorry.
That's all right. I like the mid-selfie show.
Mid-show selfie. That's a first.
It's a first.
Ain't nothing wrong with that.
Yeah.
First time Bryan's on, he's taking advantage of it all.
Heck yeah. Yeah. So potentially really bad injury.
Mm-hmm.
The hip is a deep ball and socket joint. We've talked about it where your shoulder's like a golf ball sitting on a golf tee. Shoulder dislocates way more frequently.
Right.
It takes usually a lot of force, a lot of energy to sublux or dislocate a hip. And, if you dislocate, oftentimes you break a bone along with that. The vascular, there can be vascular compromise to the head of the femur, the ball and socket joint of the hip. And like that can lead to a lot of other issues. I hope in this scenario, and the way I think that this works out fairly frequently is you just need some time, do some strengthening, do some physical therapy, and it probably won't happen again. There probably won't be sequela, but that potential is there, and you do worry about it.
And I think with that, the potential is just the high velocity of the sport of basketball and just Ja Morant. That guy flies. Man.
Yeah,
he just flies around. He can jump super high.
Bogus.
When you jump that high, you got to come down that hard.
Eventually.
And if you get hit and altered,
it might be like 30 seconds later, but eventually,
eventually you come down, and when you come down and you're not on the exact trajectory that you kind of thought you were going because you got hit in midair, it could happen again.
That's exactly right. Yeah.
But again, I think it's one of those freak things that just
there are predisposing factors that sort of set you up for this. One like kind of this loosey-goosey flexibility composition, which I have no idea if John Morant has or not. But then also the shape of the hip, the ball and socket joint. So sometimes people have a deeper ball and socket, and for some people it's a little more shallow. And that if it's a little more shallow, a little bit of what we call dysplastic, that would set them up to potentially have this issue. And another one is typically the socket and your hips are like little radar cups, and they point forward just a little bit. So the back part it's harder for it to slide out the back because those cups are pointing forward a little bit. But some people they point kind of straight out, or even worse, if they point posterior or backwards just a tiny bit, now you're sort of a setup to have this thing happen. So hopefully this is just a one-time freak thing for him, but I guess time will tell. Yeah. Throwing a bunch of stuff at you, Brian. What do you think?
Brain is exploding. I'm happy this guy's not an NHL goalie because that would make his life a living hell.
Right.
Yeah, I mean, for goalies, when they have hip injuries,
it's the rest of their lives.
Yeah,
rest of your lives.
I think a lot of it with goalies would be like hip labrums.
So that's exactly where I was going. So that is one of the worries here. Like I hope this was just some reps and it popped back in. He didn't tear his labrum because it could be the beginning of the end if he did. Like that's a bad injury.
Yeah, you don't want that trickle-down effect of that long term. It's just not going to end too great.
Right.
And then while we're talking about hips, Oklahoma City Thunder center Chet Holmgren back on a couple of days ago, just on the 10th here, he was playing the Golden State Warriors, went up for, I think he was going for a defensive rebound. He was playing defense against Andrew Wiggins. Wiggins was coming down the lane. He went up and took an awkward fall, fell right on his hip. Right. Like he went very much vertical, fell right on the floor, right on his right hip, and he was down in a lot of pain. Yeah. And typically you see that a lot in basketball. That it's not super common, but a lot when guys go up, they come down, they get hit, their legs come out, and they land on the hip. Yeah. You think best case scenario, although it's not great, it's like a hip pointer, just a big old bruise on the iliac crest there. Right. But his reported that he fractured the right iliac wing when he took that fall, and they're reporting he's out about 8 to 10 weeks.
That's why I developed a gut.
A little extra padding.
That's exactly why. No other reason. It was
and
just
you're not
to protect
7
myself
foot tall and then all skin and bones, right?
Yeah. So not a trauma doc. So laying a little bit of crepe right up front, but typically with that injury, usually it's non-op. Like depends, especially in this like direct compression or direct hit. Lower energy, not like a car accident or went down on his motorcycle kind of a thing. Usually is only a little bit of displacement, if any at all, and really the answer is just give it time to heal. Like there's not a whole lot to do for it. Nope. But sometimes it can be a really bad injury, especially the ones that are in the back. Do you know if his was anterior?
It didn't say. It just said the right iliac wing.
Yeah. So like usually that iliac crest. Did it say crest or wing?
Wing.
Oh, okay. Wing is worse because then you worry it was a little more posterior. It's supposed to, and then if it does, sometimes it goes into where the SI joint is in the back, and sometimes then you do need a surgery. And it can be really bad actually. Like people can have perforated bowel and like all this other crazy. I imagine that's not the case in this particular situation. It would be a much bigger problem already if that were. But I think it's very good news for him that they're not operating, right? They're just letting it heal.
Yeah, they just kind of said 8 to 10 weeks. And
the biggest issue is that sometimes it looks a little funky. It doesn't heal totally symmetric, right? Like there's a little bit of a tilt, and you look, but functionally, like he'll be fine. Yeah. Like it won't impact him going forward. Yeah.
That's good to see. Yeah. I'm going to skip that next one because we kind of talked about it pre-show, and we were super the oblique.
Yeah.
We'll just
such a. It came up twice now. We've never seen it came up twice now. Yeah,
real quick, I'll just talk about it at this rate. Paolo Pachero from the Orlando Magic was injured on the 30th of October, just a few days after he scored the only 50-point game in the NBA season so far. He drops 50 points, and then a couple days later, I get an update that he's out indefinitely or out 6 weeks or more with a right torn oblique. Yeah. And it's like, how the heck?
Right.
And then those things I think we've talked about it before, and we were talking about it just before show.
It was Tatis, right?
It might have been Tatis who had it, or someone baseball-related had an oblique issue. And they're just tough to come back from because all twisting and all the motion, all the agility work that they do in basketball, you're going to feel it.
You feel it, yeah.
And it's like, I think notably that Amon-Ra St. Brown from the Detroit Lions was on the Netflix documentary saying that he played all last year with a torn or issue to his oblique.
I didn't know that.
He toughened through. Like I didn't watch it yet, but that's one of the reports that came out with it. Yeah. But it's just so tough to deal with. Yeah. And then now you have someone who's like the head of a franchise, if you will, out for an extended period of time with an oblique injury. It's just going to be tough to come back from. And you hope that it's not a productivity dip for him, but we'll see what happens with that.
Right. I wonder where it is, and sometimes it can be
Right.
some herniations and stuff. And
Yeah.
yeah. It's not something. It's weird. It's one of those ones that like that's a sports injury that doesn't really get treated by orthopedic sports medicine docs, right? Like that's more of a general surgery type thing.
Yeah.
Scenario. So like and honestly like you got to have your antenna up to see it, because if you don't, you're gonna miss it, right? Like, but it is one of those weird ones where someone will come and complain of pain in that particular area, especially if you see like a little herniation there, then it really changes everything.
Right.
It's very obvious. But typically that would go to general surgery, then it would come as opposed to come to us.
So just trucking through this list here, the next one would be Kevin Durant's injured again. Again, just someone who's just been in and out of injury issues or not. But the interesting thing here is that he has a left calf strain, and I reference calf strains and I use Kevin Durant as an example almost regularly in my practice because of what happened in the finals of 2019 when he had a calf strain on his right side when he played with the Warriors. Tried to push through it too quick. Next thing you know, his Achilles popped.
Yeah.
And it's just like,
we keep seeing it.
Oof.
Aaron Rodgers.
We talked about it briefly, I think, with Joe Burrow coming into this season or last season because he had a little calf issue, and you always worry about that.
He's playing well. The team,
not so much.
Well, they're okay. They're okay. Yeah. But he, oh man, better than I thought he was going to, given his wrist. But that's another story.
Right. So it's interesting that I think it's going to be a fun story or interesting story to watch, if you will, of how Kevin Durant, he got injured on the 8th of November. He said the reports were saying that he'd be reevaluated in about 2 weeks. And so that takes us to kind of like next week of when it'd be. I would imagine that he would be very cautious on his return.
I have to imagine as well.
He's how old now?
35, 36.
Is he that old?
I think he's up there.
He's on the
he's on
the wrong side of his career. Yeah, that's for damn sure. But.
Yeah. Which is why like all these calf things and tweaks and stuff happen. But wow, that's older than I would have.
36 years old.
But he came out with Nate Odom, right? That's the same year that Odom.
It was Odom Durant.
Yeah, exactly. Yeah. So he is.
He's up there. 36.
I have to imagine it's a sort of a bold guess, and I hate to say, but it's going to be a nuisance all year long. Even when he comes back, there's going to be downtime and whatnot. Like
he hits all the markers of someone who would have an issue with calves, right? Like pre-existing injury. Granted, it was on the other side, but still, he had it before. Something similar. He's older in age, which we see. He's a male, which we see older males all the time have this calf issue. So
he's so good.
So good when he's healthy, man.
For so long.
It's ridiculous.
I know.
Ice cold shooter, man. He just doesn't miss.
Right. Yeah. It's amazing.
And it's been amazing to see him play for so long. And it's like, he's getting up there with all these guys who've been the faces of the NBA for so long. They're on their way out.
Right.
It's going to be a new era of people.
It's weird to see that.
Yeah.
Like you're older than us, so you've seen this a couple times.
Thank you. Yes. Multiple times.
Brandon and I are about the same age, and we're like, those guys
in
are
the
like starting to walk out.
You should have seen it.
And then, it'll be interesting to see how this kind of unfolds with everything. I think it'll be much longer than 2 weeks.
Yeah.
I think he'll be out for sometime in December. He's coming back.
And we don't know the grade, right?
No, we don't know anything.
Yeah. I have a feeling, and then when he does come back, I think it'll be longer than 2 weeks. And when he does come back, it'll be with caution. There may be some load management coming into play.
He's on the tail end of his career.
Yeah.
Does this bother him the rest of his life?
I don't think so.
On an everyday basis?
Yeah.
I don't think so.
No, I think depending how
he's an athlete. He knows how to take care of himself,
Yeah.
right? Like he's going to be way more aware than most. But
Yeah. I think it bothers him for the rest of his life in a sense that he's always has a lower threshold to retweak it. But he'll figure out how to just stay under that threshold for the most part. But then he's just walking around and doing stuff during the day, every day. I don't think it's even a consideration in his mind. Yeah.
I think you'll have more of a psychological limitation with this one.
Right.
Just based off, it happened before. Like, you had a calf strain, you try to push through, and then, you're out for 10 months with the surgery and all this stuff. So, and I kind of dove into, the timeline of back when 2019 and how it all happened. And he really thought it was done then. He thought that was it.
That was his career.
He thought his career was over after that Achilles tear. And, granted, it's gotten better. Achilles tears have gotten better. They're healing better. They're getting better surgical, like we've talked about.
Technology.
The technology, the
Arthrex again.
Arthrex again, making the internal bracing and all that stuff. Yeah. It's changing the game in that regard, but I think he'll be a little more hesitant to push the envelope with this.
I agreed. And then what's we got this last one on the list.
Yeah. Last one we mentioned earlier, Lonzo Ball with a sprained right wrist back in the 30th of October. But it's interesting because they said that if he continued to play with it, he might have needed season-ending surgery, and that the Chicago Bulls were saying they dodged a bullet on how bad the injury was. And again, the wrist sprain is very broad umbrella term.
Yeah.
And we've talked about a lot
Is this a scaphoid fracture? Is that what we're talking about here?
I don't know.
Or is this a scapholunate ligament thing?
It could be.
Yeah.
No
What do you
clue
think?
what you just said.
Yeah. So you agree?
Exactly. I concur.
Yes, I concur.
No,
Should have concurred.
And I think it's just terribly ironic. I think our show came out. I think this happened on like a Wednesday night, and I didn't even realize it. We recorded the show on Tuesday.
Yeah.
That following Wednesday, he gets injured, and then our show comes out on Friday, and we're like, oh my God, Lonzo Ball's back. He's doing all this great stuff, and I looked, and I was like, oh wait, he's actually out again. Whoops.
So yeah, that's very interesting. So you know, what I was just mentioning, where I was just going, right? Pretty notoriously, people will go into the ER after a wrist injury, and they'll be told they have a wrist sprain, and then they just not getting better, and it turns out they have something called a scaphoid fracture, which is one of the bones in your wrist, kind of like your hand area, and if it gets missed, it can become a much more involved recovery process. And it's just a little bit notorious because it's where it is. It's a little bit hard to see on the X-ray and whatnot. And the blood supply, the way the blood comes, it kind of goes to the distal end, the far end, and then backtracks. So if there's a crack there, the proximal portion, the part like the portion closer to your shoulder, isn't getting adequate blood supply. So then it starts to break down. So it's just a notorious injury that gets missed all the time and gets categorized as a wrist sprain. So I wonder, like, is that what happened and they just caught it? And then there's this other thing where we actually talked about it, I think with
Joe
Dr.
Burrow.
Jones. But yeah, with Joe Burrow, that's exactly right. And so you can have this injury to a ligament that kind of goes between that bone we were just talking about, the scaphoid, and the one that's right next to it, the lunate, and you get a little bit of widening. Those two can separate. That can also lead to a bunch of problems if not caught and addressed. So my gut is that it's one of those two particular things that happened to him. Did they operate?
No, it seems like it's non-operative. They said he would have needed surgery. So it's interesting. This kind of
so I think with both of those things, and I am not a hand specialist. That is my biggest weakness in the world of orthopedics. but I think with both of those things,
mine
if you catch
too.
them early, yours too. Yeah. Everything else you got covered.
I got to figure it out. It's great YouTube channels.
Isn't it amazing, man, what you can do on YouTube? I learned to ski by YouTube.
Really?
That is a honest story. Yes. Yeah.
No, there's a conversation.
Right. For another day. But yeah,
sure.
I think you can treat both of those conservatively without surgery if you catch it early. But with the scaphoid fracture, it depends on how bad the fracture is. Some of them need surgery. Sometimes you can cast them, whatever, and then let them heal.
So again, we'll see. So it's all this stuff we'll follow up on as we go on with more shows. And we will be taking a small hiatus from the show for a little bit.
Yeah, good stuff happening.
Good stuff happening. I'm expecting my next son next week, so we are going to take a little break. I'll be on super dad duty. Appreciate it.
Yeah.
So we'll figure all that out as we go. But before we wrap up, anything else for the night?
Some
Brian said he was
action.
going to stay on the show for 10 minutes, and we're almost an hour.
We didn't let him
in.
go, man.
I'm in trouble.
Yeah. You better selfie again.
But if I'm already here, you can't get
you're
more
already-
trouble.
Right. And then now you know what it's like to do the show for an extended period of time. When we hit that hour mark, I think we all kind of get those texts from our wives like, "Hey, what are you doing? You coming home?"
I think you should be beer number 2 at this point. To be honest,
The
with you.
good news is I live 100 yards from here, so getting home is very
It's
quick.
easy. Yeah.
There
Very
you go.
quick, Yeah.
That's great stuff. So before we go ahead and close that our tab, just a quick shout out. Appreciate you, Brian, for coming in.
I really
thank
appreciate
you
it. I had a
very
lot
much.
of fun.
This
It
was
really
Glad
cool.
we finally
We've
get
talked
you
about this,
Yeah.
doing this for, I don't know, we're on 118 tonight. This is episode 118. We've probably been talking about it for at least, I don't know, probably 100 episodes.
the
at
last
this rate.
100,
Yeah,
110, something like
I
that.
feel
Something
like
like-
Jason was still here when we first started talking about it.
Yeah.
Without question.
Yeah, and that
Yeah.
was pre-episode like 40-something.
Yeah.
I think Jason made it to 50-something before I took over.
Right.
And I'm glad we made it work out. I mean, work coming on a Wednesday, worked out in all
Yeah.
regards in my book.
Yeah, there's gonna be too big a hiatus. I'm glad we were able to get this.
I'm
to
glad
work.
we were able to get
And
this
then
thing.
as
Very
a
cool.
bonus,
As a bonus, we got
Very
Bryan,
cool.
Yeah.
our infamous bartender that we've talked about so many
Bryan
times. on this
behind
show.
the bar.
Behind
Love
the
it.
bar as always. But tonight he's on behind the mic, which is
That's
great
right.
as well. Next time we'll get at hockey stuff and we'll give you some more alley oops, a little toss ups, make it a little easier for you.
Alley oops in basketball, I know that. I told you I coached.
We'll
fifth
give you some
grade.
good one timers. You know what I mean? So before we go ahead and close out our tab, we're just going to give a quick shout out to our sponsors, Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip. They have a doc for that. Yard work, back, and laptop wrist. They also have a doc for that. Virtual Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. Find the right specialist for you at virtual.org/ortho. Neck of the Woods Brewing Company, giving us the coldest beers and the best beer
Giving us
in
Bryan.
all South Jersey, and giving us Bryan tonight. And our guy Chris is behind the bar tonight, giving us all the great drinks. And lastly, Timberreel Productions helping us get all this together and put all the audio and video out to all our supporters and listeners. So give us a like and follow on social media, on our Instagram and YouTube, and we'll very much appreciate it. So till next time, folks, we'll see you.